Hello, hi, good evening, everyone. Welcome back to another OET Speaking Speculation Live. This is me, Richard Caroline, joining you from Nedus Academy. So, yes, good evening and welcome back, all of you. Yes, good evening, good evening. I hope all of you are staying safe and healthy and your preparation is going well as well. Okay, so after a very long time, we are going to start back with discussing cards. നമ്മളിപ്പോൾ കുറേ ലൈവുകളായിട്ട് സ്പീക്കിങ്ങിന് വേണ്ടുന്ന കുറച്ച് ഇമ്പോർട്ടൻറ്റ് എലമെൻസുകൾ പ്രിപ്പയർ ചെയ്തുകൊണ്ടിരിക്കുകയായിരുന്നു, അത് പഠിച്ചുകൊണ്ടിരിക്കുകയായിരുന്നു അല്ലേ. അതിൻ്റെ ഇൻട്രൊഡക്ഷൻ, 3 മിനിറ്റ്സ് എങ്ങനെ എക്സിക്യൂട്ട് ചെയ്യണം, എന്തൊക്കെ പോയിൻറ്റ്സുകളാണ് എക്സ്പാൻഡ് ചെയ്യേണ്ടത്, 3 മിനിറ്റ്സിൽ എന്തൊക്കെ കാര്യങ്ങൾ നോട്ട് ചെയ്യണം, ഇങ്ങനത്തെ കാര്യങ്ങളൊക്കെയാണ് നമ്മൾ ഇത്രയും ദിവസങ്ങളായിട്ട്, അതായത് ഓൾമോസ്റ്റ് ഒരു 4 ആഴ്ച ആ 4 ആഴ്ചയിലെ ലൈവ്സിൽ നമ്മൾ ഇതാണ് ഡിസ്കസ് ചെയ്തുകൊണ്ടിരുന്നത്. സോ ഐ ഹോപ്പ് യു ഗൈസ് ഹാവ് ഗോട്ട് ഓൾ ദീസ് ഇൻഫർമേഷൻ, എല്ലാം നോട്ട് ചെയ്ത് വെച്ചിട്ടുണ്ടാവും എന്ന് വിചാരിക്കുന്നു. ഇപ്പോൾ ആരെങ്കിലും അത് മിസ് ഔട്ട് ചെയ്തിട്ടുണ്ടെങ്കിൽ ദാറ്റ്സ് കംപ്ലീറ്റ്ലി ഓക്കെ. പ്ലീസ് ഗോ ബാക്ക്, റീ വാച്ച് ദീസ് വീഡിയോസ് ആൻഡ് ഗെറ്റ് ദ ഇൻഫർമേഷൻ. ഓക്കെ, സോ യെസ്, അപ്പോൾ ഇന്ന് തൊട്ട് വി ആർ ഗെറ്റിംഗ് ബാക്ക് ഓൺ ട്രാക്ക് വിത്ത് കാർഡ്സ്. ഇപ്പോൾ എക്സാം മോഡൽ കാർഡ്സിൽ ഡിസ്കസ് ചെയ്യുക എന്നുള്ളതാണ് നമ്മുടെ ലൈവുകളുടെ ഒരു ഹൈലൈറ്റ് അല്ലേ. അപ്പോൾ വി ആർ ഗെറ്റിംഗ് ബാക്ക് ഇൻ ടു ദ ട്രാക്ക്. അപ്പോൾ ഇന്നും നമ്മളൊരു എക്സാം മോഡൽ കാർഡാണ് ഡിസ്കസ് ചെയ്യാൻ പോകുന്നത്. അത് വന്നിരിക്കുന്ന ഒരു കമ്മ്യൂണിറ്റി ഹെൽത്ത് സെൻറ്റർ കോണ്ടെക്സ്റ്റ് ആണ്. സോ ഐ ഡിസ്പ്ലേ ദ കാർഡ് റൈറ്റ് നൗ ഹിയർ. സോ വിതൗട്ട് വേസ്റ്റിംഗ് മച്ച് ടൈം, ലെറ്റ്സ് ഗെറ്റ് ഇൻ ടു ദ കാർഡ് ആൻഡ് റിമെമ്പർ യു വിൽ ഹാവ് 3 minutes to prepare it, and after that we'll start with the discussion. Alright everyone, so welcome back. I hope you got enough time to prepare the card, go through it, get the facts right. So now let's look into this context and see how we can decode this card. Okay, so let's start reading from the beginning. So the setting is given as a community health center and background information says your 52-year-old patient has presented to the community health center for a dressing change after experiencing mild pain. You're currently discussing wound care and pain management. First task is to confirm the reason for the patient's visit, dressing change. Now, from all these details, you can understand this is happening at a community health center, and you understood that this is your patient because the term your is mentioned here. So your 52-year-old patient means this is my patient. I might have taken care of this patient previously. So the patient has come here for dressing change. So since it is a dressing change, that is indicating there must have been a previous visit of the patient. ഇപ്പോൾ ഡ്രസ്സിങ് ചേഞ്ചിന് വന്നിരിക്കുന്ന കേസാണെന്നുണ്ടെങ്കിൽ അതിന് മുന്നേ ഡ്രസ്സ് ചെയ്യാനായിട്ട് വന്നിട്ടുണ്ടാവും അല്ലേ. അപ്പം അങ്ങനെ വന്ന സമയത്ത് ആ പേഷ്യൻ്റ് നിങ്ങളുടെ പേഷ്യൻ്റ് ആയിരുന്നു എന്ന് സൂചിപ്പിക്കുന്ന ഇൻഫർമേഷൻ അവിടെ തന്നിട്ടുണ്ട്. ഓക്കെ, സോ ദാറ്റ് മീൻസ് ദിസ് ഈസ് എ നോൺ കേസ്. ഇതപ്പോൾ എന്ത് കേസായി വരും? ഇതൊരു നോൺ കേസായിട്ട് വരും. യുവർ പേഷ്യൻ്റ് എന്ന് കൂടെ മെൻഷൻ ചെയ്തിട്ടുള്ളത് കൊണ്ട് ദിസ് ബിക്കംസ് ദി സെക്കൻഡ് കാറ്റഗറി നോൺ കേസ്. സോ ദിസ് ഈസ് ഹൗ യു കം ടു നോ what is the context that you are going to deal with right now. Now, what you are going to do is the first task is to confirm the reason for patient's visit. So that means you need to check with the patient, aren't you here to change the dressing? അതിനല്ലേ നിങ്ങൾ വന്നിരിക്കുന്നത് എന്ന് ചോദിക്കുന്ന രീതിയിൽ വേണം നമ്മൾ എന്ത് ചെയ്യാൻ, കൺഫേം ചെയ്യാനായിട്ട്. ഓക്കെ, സോ ലെറ്റ്സ് ലുക്ക് ഇൻ ടു ദ പോസിബിൾ ഇൻട്രൊഡക്ഷൻസ് ഹിയർ. സോ സിൻസ് ദിസ് ഈസ് എ നോൺ കേസ് ആൻഡ് സിൻസ് ഇറ്റ് ഈസ് ഗിവൻ ദ പേഷ്യൻറ്റ് വാസ് യുവർ പേഷ്യൻറ്റ്, ഡെഫിനറ്റ്ലി ഡ്യൂറിങ് ദ 3 minutes you need to ask for the name of the patient. So let's call this patient Philip. Imagine the name of the patient is Philip. Then how would you start the introduction? So there can be 2 types of introductions that you can use here. So let me take you through the types of introduction here. So the first context is you greet, okay, and then you just tell the patient simple as that. Okay, you can greet the patient like good evening, hello Philip, how are you doing today? So I did this because it is mentioned this is your patient, so that means it is my patient and I know this patient and my patient knows me back, so I don't have to go through the entire step of verification and my self introduction and things like that. So simply I can say this, and when Philip says I'm experiencing some mild pain, that's the reason why I'm here. So what you can do is you can acknowledge it. I'm sorry to hear that. Don't worry. Don't worry. Let me look into it. Let me look into it. Something like that. Okay, you are just assuring the patient about the context. And after that, your first task is confirm the reason for patient's visit, dressing change. So you can say first, oh Mr. Philip, I hope you're here for a dressing change. That's how we can confirm it. How can I confirm it? I hope you are here for a dressing change. So when you say like this, you have actually executed task number 1. So this is one way of doing the introduction. I hope it's clear to all of you. Now let's look into another context of doing it. Okay, so now since it is just given that it is your patient, it is not mentioned like how long the patient was under your care or whether there's a possibility the patient would still remember who you are. So our clarity illathathu konda what you can do is you can just give your introduction in a way like you are reminding the patient who you are. Okay, so you can give like this. You will greet maybe with the name of the patient, with the name of the patient, And then you will self-introduce yourself like this. I hope you remember me. You can say your name, Richa, one of the registered nurses working here. And I took care of you. Last time you were here. This is another way of doing it. Okay, so like you're reminding the patient who you were, and then you're continuing with the conversation. So after this point, you can say, I believe, since you already used I hope, now you can change that to I believe you are here for a dressing change. You're here for a dressing change. So this is how you can do this particular context. Okay, so these are the two types of introductions you can try. And the first one, you can simply say greeted, and you can just move on with the context by saying, I hope you remember me. And then you can start by introducing yourself and then ask like, okay, aren't you here for the dressing removal or dressing change? This is one way of doing it. Or on the other hand, what you can do is you can greet, and then without your self-introduction, you can act as if the patient knows you and you know the patient back. Both of these introductions are kind of like okay in this context. You don't have to worry too much about, do I really have to do this like by self-introducing myself? No, you don't have to. It is optional, so I hope you got an idea about that. Okay, yes, good evening, Angel. Alright, now let's look into the next context. After you confirm the reason for the visit, your next task is to elicit more details about the pain. You need to ask questions like the onset of the pain, the intensity of other symptoms like redness, swelling, discharge, fever, etc. So the action verb we can see here is elicit. This is quite a common exam keyword or an exam action word that you can see. And what is the meaning of this word? Elicit means ask or find out. In other words, you can see or consider this as provoking the patient to get more information from the patient. That is what is called elicit. So if you try to replace that word with a word that you already know, like ask or find out or gather or get information from the patient, that will be a little more easier for you to understand the context. So in this particular context, you can change the word elicit into ask. Then that becomes ask more details about the pain. So here, since it is information gathering, it is really important that you always start information gathering by signposting. And what do you mean by signposting? Signposting is nothing but it is a method of showing the patient or the bystander what is going to happen next, or what is the point that you're going to do next, like whether you're going to ask questions, whether you're going to give any suggestions, recommendations, or whether you're going to get into any explanations. So this is what is called signposting. And why is it important? It is really important that you signpost so that the patient will not be confused when you start into an explanation or when you start to ask questions. They will not be taken by shock and they will not start to think like, okay, why is that person asking me questions right now? ഈ തരത്തിലുള്ള confusions ഒക്കെ avoid ചെയ്യാൻ it is really good and really important that you always signpost before you change the topic. Whenever there is a shift in your topic, whenever you move on to another topic, or when you start to ask questions, give suggestions, or give any explanations, it is important that you have to indicate, okay, now Mr. David, I'm going to do this. Mr. David, now I'll be discussing these things with you. So when Mr. David hears the signposting, he will be ready to receive your information. Okay, that is how important it is to do the signposting. And since it is information gathering, it is important that you signpost and tell him that you're going to ask questions. നിങ്ങൾ ചോദ്യം ചോദിക്കാൻ പോവുകയാണ് എന്ന് മുൻകൂട്ടി പറയേണ്ടത് important ആണ്. So how can we do that? You can simply say, Mr. Phillips or Mr. Philip, before proceeding, I would like to ask some questions about the pain you have been experiencing. The pain you've been experiencing. And once you have signposted, it is important that you take permission. So what do? May I? As simple as that. May I? So the patient will be like, yeah, that's okay. Fine. You can ask me the question. So the patient will also be ready with the answers for your questions. So what is the first one? Onset. So the patient said the patient has been experiencing mild pain, and you need to ask the question regarding onset. And onset means you need to know when it started. So simply you can ask, when did it start? Okay, this is the basic, easiest question format that you can use to expand the word onset. Now, if you want a little more of an expanded or an advanced statement, you can try something like, when did you start to experience the pain? Okay, this could be a little more of an elaborated version of this onset which I have given here on the screen. But I would recommend to go with this one because this is easy and you don't have to worry too much about it. Now, whenever you come across the word onset, you need to think and check and confirm whether it is regarding an injury or whether it is regarding a symptom. If your question is about the onset of an injury, you cannot use this, because you do not start an injury. Injuries always happen. About the verb marum, verb will become happen. When did it happen? Okay, now if it is a symptom, symptoms don't happen, they start. So when did it start? This will be the difference there. Okay, so be careful about which onset you're going to ask in this context, and then you can change it. So after onset, you have the next question, which is intensity. So you're trying to understand the intensity of the pain. So you can simply ask, how severe is the pain? How severe is the pain? I have heard some people just basically very easily ask this question like, what is the intensity of the pain? Which is also fine. Okay, that's absolutely okay, because that is not changing the context, that is not changing the entire sense of the question. That is also getting the right amount of information that you need. So either you can ask like, how severe is the pain? Or you can ask the question like, what is the intensity of your pain? Now, other symptoms like redness, swelling, discharge, fever. So what you can do is, you just need to ask the patient, do you have any other symptoms? Do you have any other symptoms? And then you can just list down the symptoms mentioned here, like redness, swelling, discharge, or fever. This is one way of doing it. Now, if you want, you can go in a single go, or if you want, you can break it down into two different questions as well. Like, do you have any other symptoms like redness or any swelling? Then you can get the answer, and then ask the next one, discharge or fever. Have you noticed any discharge, or do you experience any fever lately? So this is how you can complete that question as well. Okay, so once you get information for that, you can move on to the next one, which is also information gathering. Find out about the patient's current care of wound and pain management. So once you finish all this information, you can give a brief summary here. So thank you for answering all my questions. From what you told me, I totally understand that you started experiencing the pain 1 week ago, and the pain's intensity varies. Sometimes it is tolerable, sometimes it becomes really intolerable. You don't have any other symptoms like redness or swelling, but you don't noticed a little bit of discharge, and you had a fever last day. Am I right? Whatever information you received from the patient, based on that, you can provide them a brief summary here. Now, once the patient confirms to your collected detail, you have to move on to the next one, which is find out about the patient's current care of wound and pain management. How often, dressing change, type of dressing, self-administered pain relief, effectiveness. So there are a lot of information to be covered here. So let's look into it one by one. All right. So here you can see, find out about the patient's current care of wound. So you can simply say, all right, Mr. Philip. That's enough, okay? All right, Mr. Philip. I would like to find out more about the current care of your wound and the pain management you have chosen. The pain management you have chosen. Okay? And you're going to ask the question separately. How often dressing changed? Can you tell me how often you changed the dressing? Can you tell me how often you changed the dressings or dressing? Okay, that is one question. Type of dressing. What type of dressing did you use or do you use? What type of dressing do you normally use? That would be a complete question. Do you normally or usually use? Self-administered pain relief. Did you try any self-administered pain relief? Did you try? Okay, did you try? Don't say tried because already we have did. So did you try any self-administered pain relief? So the patient says yes, and your next question is to find out the effectiveness of that. How effective was that? How effective was that? Or you can ask a question like, was it effective? And did you find any pain relief? All these are different questions you can try in this context here, okay? So this is how we can complete that particular task. Now, let's look into the next context. So the next context here is, explain the next steps: assessment of wound, size, depth, signs of infection, redressing the wound, administration of pain relief, etc. Find out any concerns or questions. So you're going to explain the next steps to the patient. So you can simply say, Mr. Philip, thank you very much for answering all my questions. So now let me tell you what we are going to do next. To begin with, I will start by assessing your wound. I'll assess the size and the depth of your wound and look for any signs of infection. And after that, I'll redress the wound and also I will administer a pain relief medication to you. Is that clear to you, Mr. Philip? And he says yes. So do you have any concerns or questions? It is as easy and simple as that. So let me redo that one more time. Please listen very carefully. So Mr. Philip, let me tell you what we are going to do next. To start with, I will assess your wound. I will check the size and depth of your wound and look out for any signs of infections. And after that, I will redress the wound and then administer a pain relief medication to you. I hope that's okay with you. Do you have any concerns or questions? So the patient will be like, okay, yes, thank you so much for what you're going to do now, but I have a question about the home pain management. So after going home, how will I manage my pain? So you can acknowledge to that point. Okay, well, that's a really great question, Mr. Philip. Let me explain regarding home pain management. It is important that you keep the wounded area elevated and you take adequate rest and you take the pain medication as prescribed by the hospital or from the hospital so that it won't be a problem for you. And about the wound care, please keep it dry and clean and change the dressing regularly. And it is important that you check out for any signs of infection. If you notice anything unusual, please reach out to us or please inform us immediately or please come to the hospital straight away. Okay, any of these explanations can be substituted in this particular context. So that is how we can do the second last task. Once you have finished this context, you can ask the question, do you have any concerns or questions? So let me just show you this task one more time, okay? So that's a great question, Mr. Philip. Speaking about the home pain management, it is important that you keep the wounded area elevated and you take adequate rest and continue with the pain medication given from the hospital. Now, speaking of your wound care, it is important that you keep the wound dry and clean, and you change the dressing regularly, and also you need to look out for any signs of infection. In case of any unusual things being spotted, it is important that you come down to the hospital at the earliest. I hope you will take care of it, Mr. Philip. He says yes. So that's how you can complete that second last task. Now, once you have completed it, you just need to ask the patient, do you have any other concerns? That is the point you will do, okay? You will ask the question, do you have any other concerns? As simple as that. Now, after that, when you ask this question, the patient will ask you like, no, I don't have any other concerns. Everything else is clear to me. Everything is fine. So you are going to explain the last point, which is explain other discharge instructions like attend scheduled appointments, report concerns early, avoid activities that strain wound, establish consent to begin wound dressing. So these are the points that you need to expand. So let's see how we can do that. So you ask the question, do you have any other concerns to the patient? The patient said no. So you can say, well, in that case, I would like to talk to you about the discharge instructions. It is very important that you attend the scheduled appointments without fail so that we can assess your progress. And in case if you have any concerns or any doubts or any issues bothering you, it is important that you report to us very early or at the earliest. And remember to avoid activities that could strain the wound. That could. Okay, strain ചെയ്യാൻ സാധ്യതയുള്ള എന്നുള്ളൊരു മീനിങ് ആണ്. That could strain your wound. So if you take care of all these things, you will be able to manage the pain at home very easily. So please don't forget about the instructions told to you. Remember to follow it correctly so you will start to see the changes, and in case of any emergencies, feel free to contact us. So is there anything else I can help you with, Mr. Philip? Mr. Philip says, no, nothing else. Everything is clear. So you can say, well, thank you very much for your cooperation. So with your permission, can I start with the wound dressing? So patient says, yeah, that's okay. Now, I would say in this card, they're talking about wound dressing, but I would recommend you saying, so with your permission, can I start the assessment of your wound? Because your fourth task, you can see explain the next step. You're starting with assessment of wound, and later you're going with the wound dressing. So first thing to do is the assessment. So instead of saying, shall I start with the wound dressing? We can change that. Being logical, you can change that and say, so with your permission, can I start to assess your wound and then dress the wound? The patient would say, yeah, that's okay. So you can say, thank you so much for understanding. Please be relaxed. I will look into the wound. This is the ending of this particular card. So I hope you got a picture about how this entire card can be done. This is a very pretty easy card because you have the direct points. It's a self-explanatory card. You have all the information that you need available here. All you need is the proper explanation of the tasks and the sentence construction quality. So if you have that, then you don't have to worry too much about this card. I hope you got an idea about the signposting statements I did, the summaries I provided, the way the sentences were constructed. So please make sure that you do practice it accordingly. You try to do this card at least 2 times. രണ്ട് പ്രാവശ്യമെങ്കിലും ഈ കാർഡ് ഒന്ന് ചെയ്ത് നോക്കുക and see whether you can do it. Now, these are all exam model patterns. So if you are planning to write the exam very soon, this is something that you need to practice on because these types of cases are kind of like repeated. So in context repeat it will be easier for you to speak if you have an experience of doing these type of cards. Okay, but keep that in mind. Now, I'll be coming back next week, that is next Tuesday, with another topic. So make sure that you keep on practicing, and if you have any questions, you comment down in the comment section. I will definitely look into it, okay? So I wish you all a happy Onam. Enjoy your break and everything. So whenever you are enjoying, remember the points that if you're planning to write the exam anytime soon, you need to practice as well, but still enjoy the break, okay? So happy Onam, everyone. I'll talk to you next week.